am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care today. I'd like to introduce my two guests who are with me today, who've joined to share their child's experience with vomiting. No doubt vomiting is one of the more unpleasant events for all involved. I think my guests would agree with that. This is Callie, the mother of Cooper, an extremely busy 11-month-old, and Galadriel, the mother of Darian, who is 2 months old and can probably match Cooper in energy, I would guess. Welcome. Let's start with you, Callie. Why don't you talk about the episode that your child had with vomiting? What exactly happened during that time?
Well, it started off with a nap. Cooper and my older daughter and myself were napping, and we woke up, and all of a sudden it was all over us. So I stood up, obviously changed everybody, cleaned up the situation, and gave him some water, and noticed that it was still coming. And it was all over my kitchen floor, my dining room floor, and I started to get worried at that point. I called Dr. Cronus, and I noticed that he hadn't gone to the bathroom for quite some time, and he was laying on my shoulder again to take another nap, and that's when I got concerned.
How many days did the vomiting go on?
Just 2.
2 days. And was there anything else with the vomiting? Any cough, runny nose, fever,
No.
diarrhea? Just
No.
had vomiting.
Just vomiting.
And then it went away after that. Was anyone else in the household sick?
My daughter,
What did she have?
she had a little bit of a fever,
Mhm.
but not vomiting.
Okay. And what happened with your child?
He first refused to eat, and then he was sent home from daycare due to vomiting twice at daycare. Then we got him home and proceeded to continue to vomit everything that I was attempting to give him.
So what did you keep doing when he was vomiting?
Just try to comfort him and I was trying to give him Gatorade, water, just anything to keep him hydrated. And it was a long road. But it lasted about 2.5 days. So it was over the weekend, in fact, kind of stuck. But
Were there any other symptoms with that also?
no, just mostly the vomiting. And it was really great when it was projectile.
It just came flying out. Was that your child's first episode of vomiting?
No, it was our second.
Second time. How long ago prior was the first, do you recall?
I would say about 4 months.
And was that your child's first episode of vomiting?
It was.
It was, okay. It's sort of a little overwhelming, isn't it?
It is. My daughter, who's older, never had that, so it was a new experience for us.
What was your biggest concern when your child was vomiting?
I was worried about dehydration. I was wondering if something, you think about appendicitis, there's all these things, and he was 8 months old at the time and was not able to, I was worried he wasn't able to tell me something hurts, and that was worrisome.
Right. And how about you? What was your biggest concern?
The dehydration.
The dehydration. I think most parents are concerned about dehydration, and the gut reaction when they throw up is to try to give them something to drink. But they're just not ready for it. So, unless you're really in the mood to clean up again, it's probably best to stop for a little while. And you'll read different things from different people. My rule of thumb in the office, because I know the parents well and can watch the children well, is to wait 4 hours before introducing anything, and then start with little sips, because if you give a full glass of anything at that point, it's probably going to come up right away again, and we really haven't given the stomach a chance to just rest long enough to take things down. Dehydration is always a concern, and dehydration is something that, if anything is going to land them in the hospital needing an IV to get fluids, it would be dehydration, but it doesn't happen instantly. So you really have to decide how little the child is and how fast they're going to get dehydrated. For a newborn or a child under 1 month of age, they need to be seen right away for vomiting. And if it's green in a child who's a couple weeks old, that's extremely concerning because you worry about an obstruction. But as a child gets older, it becomes a little bit easier to know whether a child is dehydrated. Was there any method you used or any way you used to decide whether or not you felt that your child was dehydrated, or did?
Well, I checked for dry mouth, which again, he was 8 months old, and we're not drinking juice, and it was mainly formula fed, so it was hard for me to really decipher that. And then I noticed that he wanted to lay down on my shoulder again and almost go back to sleep, and that's when I got worried, but that was the only thing.
Is there anything you did to check for dehydration?
One of the tricks that you had shown me in the office with my daughter is to check the fingers and just to watch for that. And I would check that on him, and and the dry mouth as well.
Okay. There are multiple ways of deciding whether a child is dehydrated. Some are more accurate than others. I think looking to see whether the mouth is dry and sticky or whether it's moist, if a child is crying, whether we're having tears coming out of our eyes, I think that's really helpful. A child who has tears coming out is not at the point of significant dehydration usually, and can usually be watched a little while. The mouth, if it's really dry and gummy, that's showing you that we're starting to get there. Number of wet diapers is a really great way of telling. A child under 1 should at least have a wet diaper every 8 hours. By the time they're over 1, maybe 2 a day would be sufficient, but you want 2 to 3 wet diapers a day per child. If they're urinating, it's coming from somewhere. Sometimes I have parents check capillary refill. I have to say I do that because it's an easy gauge, although it's not always the most. There are reasons why it may not be accurate, so it's important to know what's going on with your child. They can have multiple reasons, including high fever, that what we call capillary refill isn't really a solid way of checking. But basically, we're pinching the nail bed for about 5 seconds, and you just count 1/1000 up to 5, and then let go and see how fast that nail bed pinks up. And if it pinks up under 2 seconds, then we have an indication that maybe we're not dry. And sometimes over the phone, it's an easy way for me to tell that, and the mouth being moist, I sort of put pieces together. I sure wouldn't rely on any one item solely, because I think some can be a little bit misleading, but it's certainly a great way of dealing with that. Tummy pain, I think that's a really big one with the vomiting. I don't know how much the tummy was hurting with your child when he was vomiting. Did it hurt much? Can you tell?
I wasn't able to tell. He was still 8 months old, and crying pretty much is his answer to everything.
Right.
So I couldn't really tell.
How about yours?
He would cry suddenly before actually throwing up, and then he would whimper a little bit afterwards, but then it would settle, and then that was about it.
And that's really classic for just simple vomiting, where they will have a lot of discomfort. They will, and if they're old enough, they will, usually over 2, they'll say, my tummy hurts, and then suddenly they don't give you much warning. They tell you, my tummy hurts, and you better get that bucket fast, because they'll throw up all over the place. And then afterwards, they feel really fine. So that or they might whimper a little or cry. So you have some indication that their tummy is bothering them. And if it's for a short time, that's really not too concerning. But if it goes on for more than 2 hours of tummy pain, then you start to worry about, do we have appendicitis? Do we have something else that's causing them to vomit? They can throw up from the appendix from an obstruction or something going on in the tummy. They can throw up from a urinary tract infection, from a pneumonia. So there are many things that can potentially go on because of that. Typically, I like to wait about 4 hours before introducing anything, and then I like to start with small sips of something. I don't know whether either of you tried giving Pedialyte or not.
I attempted, but he really preferred the Gatorade.
Have you ever tasted it?
No.
Have you ever tasted Pedialyte? It is really foul tasting. So, well, I think it's useful and it has its place if it's just simple vomiting that's happened for a very short time, and we haven't really gotten to the point of significant dehydration yet. Because really, you'd have to go, for most children, quite a few hours of throwing up, especially if they're not having diarrhea and losing that extra fluid. You have to really go possibly a number of days before you finally get to severe dehydration. And sometimes you can just work on giving them normally what they typically give if they're a little older, although you don't want to do this long term. For short term, I'll take a 7-Up and stir it so the bubbles are out, but just give an ounce and then wait 20 minutes and see what happens. Oftentimes, we introduce fluids too soon and we give too much, and it comes flying out because the tummy isn't ready for that. So I like to give an ounce, wait 20 minutes, see what happens. We keep it down, give another ounce, wait 20 minutes, and then increase the fluids and then get back to the normal kinds of fluids that we take as we know that the stomach can handle it. Vomiting typically goes from 12 hours to 3 days, usually 12 to 24 hours. I think after the second day of vomiting, it's important to call for some help and ask the physician whether there's something going on with it. But that would be it. And then again, it's important to know whether something else is going on. I think fever is really key with that. Why are we throwing up? How do they act? Are they like themselves, or do they seem disoriented? You want to know what else is going on. These are reasons to go running to see the doctor much faster, really immediately, and not wait for that. Did they swallow something? Did they get into a cabinet? Did they get into a medication that they shouldn't have taken? No problem. I remember taking some erythromycin on an empty stomach once, and let me tell you, I was sick to my stomach within an hour. I mean, it was the most painful thing in the world. So certainly you have to think about what your child has taken in terms of medications. Is this causing a problem? Did they get into a cabinet and get into something that they shouldn't have? Did they choke on a coin or a foreign body or something that they shouldn't have? So there are other things that one really needs to be aware of, especially with the little ones who are all over the place. And I'm sure that you've had plenty of experience baby-proofing your house, both of you.
Yes.
Learn every day.
Exactly, and it never ends. And then we get to the point where they get older and we don't want to take all that stuff off because it takes too much time. I think we still have latches on our cabinets. If blood comes out when they're vomiting, that would certainly be a reason to be concerned and come to the pediatrician. It could be as simple as a nosebleed that was causing some blood, but you really never know without being looked at. So they really need to be assessed. Did you try any other treatments, either of you, for the vomiting besides just going slow and giving fluids? Did you do anything different?
I didn't.
Mm-hmm.
No, I did not.
No, okay. And as far as reintroducing solids, there's really nothing wrong with going back to a regular diet as soon as they can tolerate it. So as soon as you know that they're able to hold down food, I think we're doing fine with them. So the general approach with vomiting is to hold off until you know the vomiting has stopped for a number of hours. Start with small sips of something to drink. As they're able to tolerate it, move on to introducing solids, and hopefully within a day or two, it will resolve on its own. If it goes on for more than 2 days, it's really important to see a physician. If something else is going on with it, in addition to vomiting, it's important to see a physician. And that is our talk on vomiting, and I thank my guests for sharing their experiences with us. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to drcareys.com, where at Dr. Carey's we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ears.